This is Everything Financial Radio, and we're chatting today, and privileged to be chatting, I might add, with Professor Laurence Kotlikoff. Professor Kotlikoff is a nationally recognized economist who's been gracious enough to come back to the program today. Professor, I want to jump right in because we talk about Social Security, and in your latest book, you talk about, it may not be your latest book, you're a prolific author, but I believe it's called The Clash of Generations. You talk about the fact that we're handing bills to our children and grandchildren, and certainly Social Security fits into that area. There, I believe, my stats that I've recently read are right. If you look at only private sector workers, there's about 1.5 to maybe 1.6 private sector workers for each Social Security recipient, and obviously that math doesn't work. How would you go about fixing the Social Security program?
Well, the Social Security system is in terrible shape. It's in worse long-term financial shape than it's ever been. If you look at the trustees report that the Social Security trustees, the people supposed to be overseeing the system, put out last April, in Table 4B6, tucked in the back of this pretty long report, there's a table that shows that Social Security on an ongoing basis is 31% underfinanced, underfunded. So this means that you need to either raise taxes by 31% immediately and permanently. That's increasing the payroll tax by 4 cents on the dollar. So imagine everybody who's paying payroll taxes has to pay 4 cents more on every dollar they earn up to the ceiling. That would be a huge blow to people, a huge hit forever. Or we could have an immediate and permanent 22% cut in benefits. So everybody who's on Social Security now, including my 93-year-old mom, would have to experience a 22% reduction in their benefits every month for the rest of their lives, including all the baby boomers. They'd have to have their benefits cut 22%. So this is not my opinion about the system's condition. This is the trustees' opinion. And they ignored, the trustees are political appointees, and this table that's in their report, which their actuaries of Social Security put together, the trustees who are political appointees ignored, and they don't even discuss it in the introduction and summary of the report. They basically say Social Security's got some problems, but they can be fixed. The president was drinking this Kool-Aid when he said in the debate that Social Security just needs to be tweaked. It doesn't need to be tweaked. It's in catastrophic condition, according to the trustees' report, the Table 4B6. So how do we fix it? Well, what I would do is not throw out the baby with the bathwater, because there is a good reason for Social Security. It does deliver some very important things. So we need to have a new Social Security system for younger people. And here's what I would do. I would freeze the existing system, pay the current retirees what we owe them, pay current workers as they retire what we owe them, but not let the system accrue any new benefit obligations. And then I would have all workers put 8% of their pay into an individual account. This is going to start sounding like George Bush's proposal, but it's not. And he had a terribly flawed proposal, so I hope the people on the left listening to this will continue to listen. So everybody puts an 8% into a personal account. This is called the personal security system. And the contribution is split 50-50 between husband and wife and legal partners. So if there's a breakup or divorce, each person leaves with the same size account. The government makes matching progressive contributions on behalf of the poor and the disabled and the unemployed. And actually that progressivity feature was something that President Clinton was including in his plan to fix Social Security. Anyway, so now we've got everybody in an account, and what do we do with the money? Well, I would have the money collectively invested in a global market-weighted index fund of stocks and bonds and real estate securities, and all done by a computer, so that Wall Street has no role whatsoever, gets no fees on this investment. It's all done by a computer, fully diversified globally and across bonds and stocks and real estate. And then the government would provide a guarantee that at retirement age your account balance would equal at least what you put in adjusted for inflation. And then at age 60, when you hit your account balance would be gradually sold off for 10 years, again, subject to this guarantee, so that you couldn't lose you couldn't lose in real terms what you put in. And then converted, your account balance would be gradually over 10 years converted along with everybody else in your cohort into an inflation-protected pension that would continue until you die. And if each cohort lived longer, the pension payout would be smaller. There'd be an automatic adjustment to the payoff, so that future generations are not burdened with the longevity risks of current generations. But anyway, that's a rational system for making sure people save, making sure that they have retirement, making sure they're protected, getting them into the market, but at no cost to anybody, because it's all being done by a computer. And now you have a system that's fully funded, and we do have liabilities under the old system, but by freezing the old system, we will reduce those liabilities dramatically. And with the tax reform proposal I've discussed with you previously, we would be able to pay off these liabilities through time that we have accrued.
Professor, whenever you have trillions of dollars involved, the potential for corruption, the potential for special interests certainly goes up, in my view, exponentially. How do you assuming a system like that could be put in place, how do you police it so that the politicians don't get Wall Street involved? They don't. We have a sound system moving ahead.
Well, we'd have a set of trustees, maybe the Treasury Secretary, the head of the Fed, maybe the head of the IMF. Anyway, there'd be some people that would decide what securities should be included as part of the global market. And then the purchase and sale of these securities would be just done by a computer, just, done at the lowest price on the market. So if I buy a share of IBM stock right now, there's not much corruption involved in that purchase. So this whole system is corruption-free. It's just buying an established set of commodities on the marketplace, in the market on an ongoing basis, and getting the best bid. And a computer would be set up to do this work, so it wouldn't be subject to any human corruption. Unlike if we had a set of, if you look at CalPERS, which has a set of trustees, and then they start investing in things that help some of their friends. That wouldn't happen here. There wouldn't be any discretion whatsoever. A market-weighted index fund has to invest based on a securities share in terms of valuation in the market. It's all done by a mathematical rule, not by discretion.
Professor, I want to shift gears a minute. We've got about 4.5 minutes left in this segment, and if you're just joining us, we're chatting with Professor Laurence Kotlikoff. I want to shift gears to healthcare, because looking at the percentage of our economy, the percentage of gross domestic product that is spent each year on healthcare, that number continues to get larger. Obviously, that level of growth is not sustainable. We now have the added dynamic of Obamacare that's being implemented. Everything I have read, and you can correct me if I am incorrect, shows that Obamacare really doesn't do much to slow the growth of the amount of money that's spent on health care. So what would you do to bring health care spending back under control?
Okay, well, all my reform proposals which have been endorsed by lots of leading economists, including Nobel laureates, are at thepurpleplans.org. On healthcare, we are basically driving ourselves broke. Everybody needs a basic health plan, but we don't need to provide it at an astronomical cost to our economy and to our children, which is what we're doing. So Medicare and Medicaid spending as a share of GDP grew by 20% in the first term of the Obama administration. So the excessive growth of these programs continues. Obamacare's expenditures could explode because companies have a huge incentive to shut down their plans and send their workers over to get huge subsidies if they're low-wage workers from the Obamacare exchange system. And pay a relatively small fine for doing this, for not providing their own insurance coverage to their workers. So what would I do? I would get rid of Medicare, Medicaid, and the employer-based health care, and also Obamacare. I would start with a clean slate. And by the way, this plan I'm proposing has been endorsed by 5 Nobel laureates in economics, so it's not a crazy left-wing, right-wing, whatever wing proposal. It's a purple proposal for the reds and the blues, and you mix them and you get purple. So what would I do? Well, I would give everybody a voucher, and the voucher would be based on your pre-existing conditions. So if you have diabetes, you get a big voucher. If you're healthy, you get a smaller one. Anyway, the voucher is proportional to your expected health care costs, and under the plan, it equals your expected cost under the plan. And you take your voucher and you go to an insurance company or an HMO, health maintenance organization. You give them the voucher, and they have to provide you the basic health insurance policy for the year. So this is not a partial payment. You don't have to pay anything more. This is it. You get the basic plan. What is in the basic plan and what the basic plan covers would be set by a panel of doctors, subject to the constraint that the sum of all the vouchers, the cost of all the vouchers combined, never exceeds 10% of GDP. So a panel of doctors would sit down and say, what can we cover this year? And including what drugs can we include in the coverage? And we're going to make sure that we're going to choose coverages so that the total cost of all the vouchers never exceeds 10% of GDP. Now, that's a system that gives everybody a basic plan that makes the insurance companies compete on a commodity. It's just like, it becomes like an apple. The basic health insurance plan becomes like a commodity. If an insurance company wants to get the voucher for somebody, which is going to include a profit margin built into the value of the voucher, then the insurance company has to provide a better product. They've got to provide a better network of doctors and help, and compete to get these vouchers. So we now have a very simple system, and if you look at it carefully and kind of cut through the words, it turns out it's very similar to the German, the Dutch, the Israeli, the Swiss, the Japanese systems, and those countries, are not going broke or are not going broke as rapidly with their healthcare programs as we are. So you have to have a complete rigid control over the share of GDP going to healthcare. If the private sector, if people privately want to buy supplemental policies and insure themselves so that they can have an angioplasty at 98, but to do that under this system because they can buy supplemental insurance, it goes beyond the basic plan. But this will give everybody a basic plan and save our country and our kids. It's called the Purple Health Plan. It's at thepurplehealthplan.org, and you can go there and endorse it right there online.
Well, Professor, we're going to have to leave it there. We certainly appreciate you joining us. I would encourage the listeners to go to the website to check it out. Everything Financial Radio will return after these words. Stay with us.